Thank you, Mr. Chairman, and I want to thank our witnesses here today as well. As always, these are great discussions. Reuters noted almost 6 years ago, and several other institutions follow, that there is, on average, somewhere between 700 to 800 billion annually in waste, abuse, fraud, and a system as it currently existed that is not capable of lowering costs. Today's discussion seems to have been a little bit all over the place, but nonetheless, as a number of my colleagues have pointed out, I hope as a committee we can get beyond this notion of, okay, for the 63rd time, we're going to repeal the Affordable Care Act. It's been 6 years, and the act isn't going to be repealed. And as many on our side have said, it needs to be improved. There are many on our side that would have preferred a single-payer act that, as Mike Thompson pointed out in the military, he got pretty good service with that. And very efficient service, I might add, as well. But because of the advance of technology and science and innovation and all the things that entrepreneurialism can bring, you would think that we would even be able to do better because we're Americans. And yet what happens is, rather than us sitting down collectively and coming up with a program and a system that's better, for 6 years we've heard we're going to repeal it, instead of, okay, you guys, we're going to sit down with you on that plan that Mitt Romney submitted in Massachusetts that you then submitted that we called Obamacare. We're going to work together to make sure that we produce the most efficient outcomes on behalf of patients and people. Those people can't have individual responsibility if they're sunk at the bottom and have no means or capability or accessibility to do so. But collectively, just like we did when David Camp said, let's get together and work, let's go into the subcommittees that require us to examine what aspects of healthcare we can do to help the patient out. I note that companies like the Aetna, Mark Bartolini may be one of the most progressive and interesting entrepreneurs in the country, talking about patient-centric care and making sure they meet the patient at the household and making sure they're doing everything for the patient there to avoid stays in the hospital that cost money, to care for the patient at that level, and to do so that will combine both the best of all public health has to offer, meaning governmental public health and common sense solutions, along with entrepreneurial science and technology. I hope, Mr. Chairman, that that's ultimately what we can get to. This is nonsense. It's why the public hates us. We're having a light beer discussion here. Tastes great, less filling, repeal Obamacare. No, Obamacare's done a lot for people. The public has says, a pox on all your houses. Fix the problem for us. Today, frankly, you have a solution. I was happy to see Mr. Becerra say and see Mr. Price join, and that the bill will be submitted, that people will be able to take out. At least that's a start. This nonsense, this ongoing thing that we're going to repeal Obamacare for the 63rd time, drives people crazy. They're concerned about their health and their well-being and want to make sure that it's there for them. And frankly, Mr. Chairman, I hope we can quickly get to a position where the capable people on this committee can sit down with one another and come up with solutions. You want to know why the general public is so upset with us? It's because we don't do a thing. 6 years, you don't like Obamacare, fine. What's the solution? The solution resides within this room and with the American people. Let's sit down and get it done instead of this light beer commercial that we're having.
Thank you. Mr. Paulson, you're recognized.